Ginny, I'd love to talk to you a little bit about what impact hormone replacement therapy has on skin and how quickly people might notice a difference, or is it something that they will be able to visually see, or is it something that just is under the surface seen by a microscope?
Both. So we have reasonably good trial data now that taking what we would call systemic hormone therapy, so taking it whether you decide to do a patch or a gel or whether you decide to take a tablet, something that's going to go into your entire body, it'll hit the skin. You can't spot choose where it goes. It'll hit your guts, it'll hit your bones, it'll hit your brain. And with all of that, if you feel better, you are sleeping better, you're making better food choices, you're able to actually get out and exercise and look for yourself, that will show up in your soul, like in your aura. Like people will be able to spot you and go, wow, you look amazing, and you maybe not be able to pick it. But studies have actually shown that taking systemic hormone therapy does indeed boost skin texture and measures of collagen in the skin. What we have less studied is the skin barrier function, although it stands to reason, and anecdotally what we hear is that people's itchy skin does go away, but it hasn't been particularly well studied.
And in terms of, I have heard patients tell me that they are popping their gel on their face, their systemic HRT, or they've read online about doing this. I'd love to know I know it's a little controversial, but what are your thoughts on people using their hormone therapy like that?
I'm going to explain why I don't recommend it. But first of all, if you think that your primary objective in using hormone therapy is to make your face look younger, I think we need to have a talk about why you're using it. But at the same time, will it work? Yes. And we have lots of studies that show that topically applying estrogen to the skin, it is absorbed. It's designed to be absorbed through the skin, and it is effective, highly effective at helping reverse all of those estrogen loss effects in the skin. So that's the first thing to say. Is it going to work? Oh, yes, it's definitely going to work. And here's why I wouldn't recommend it. First and foremost, the skin on your face tends to be a little sun damaged. And as a result of that sun damage, the absorption is not as good for the reason you were put on the HRT in the first place. And we have got studies that show that the buttocks and the thighs is the best place to put it because the skin tends to be thinner, less sun damaged, and your absorption, your ability to attain the levels of estrogen in your bloodstream that we want you to have to combat your symptoms and your bone loss, that sort of thing, is better if we put it in the least sun damaged skin possible. The second thing is that if you put it on, you can't have used a moisturiser for the hour beforehand, and you can't use any other skin treatment or any other moisturiser on top of your skin for the next hour afterwards so that it doesn't compete with the estrogen that you have. Okay, that's a problem because these things, if you put it on a gel form, that's quite drying. Yes, there are little moisturisers in it, but it's not going to be enough for you, and I want you on sunscreen. Like, I definitely do not want you leaving the house. And if you are sitting near a window, the sun's UVA for aging rays that are there from sun up to sundown, 365 days a year that pass through clouds, they also pass through a window. We cannot have you leaving the house without a sunscreen on. And what are you going to do? Wake up at 4 a.m. and put your estrogen on and then not have a shower? It's problematic. So some people just go, well, I'll put it on in addition. So I'll have my estrogen on my thighs and my buttocks, and they'll put a little bit of extra on my face. At that point, we don't know what dose you're on, and we could potentially need to adjust the progesterone that you have because of if you have a uterus and we give you an excess amount of estrogen and we don't compensate for that with enough progesterone, we can get an overgrowth of the lining of the uterus. You have heard this on this podcast 100 times, and that can cause abnormal bleeding, and potentially that could be cancerous for your uterus. So there are a number of reasons why I don't think it is the best place to put it on in general. Having said all of which, if what you really want to do is you've rubbed it everywhere and there's a little bit between your fingers and you're thinking, where will I put this? I'm happy for you to rub that on your face or your neck if that's what you want to do. Just know that if you're going to put a moisturiser on top of it, it's going to be way less effective.
And what about in some of the overseas countries where they're starting to use like estriol a week? estrogen in face creams and things like that. Do you have any thoughts on that, Jenny?
So estriol is the form of estrogen that's actually interestingly made in a placenta of pregnant women. So it's a really interesting form of estrogen to put on a postmenopausal or a perimenopausal woman. Having said of which, the evidence for it being absorbed vaginally is really good, and we do have some studies of it being applied to the skin and being very, very, very effective. Our problem is that we don't know what blood levels we're getting. So if you do that in addition to the levels that you're putting on just generally, we don't know, again, whether we're going to overdose you in estrogen and whether we have sufficient progesterone. And again, it's one thing to put it in the vagina. It doesn't really compete with anything. By the way, I'm sure everybody who listens to this podcast knows that if you use vaginal estrogen, we don't have sex. And that's not about protecting your husband or protecting your partner. It's because semen is going to dilute the estrogen in there. That's a wasted dose. We don't use it and then have sex. Similarly, if we put the estrogen on your face, you're not meant to use anything else for quite a while. I don't know how practical that is for women. So if you want to give it a shot, the 0.5 ml that we normally apply to a woman's vagina that is perfectly fine and doesn't cause any issues, I think as long as you're sticking to 0.5 ml and you want to do a couple of areas in your face, I don't have a problem with that. But I think you've just got to be careful if you think that that's the only thing you're going to use for your face, or if you're going to use a whole lot. If you think that you're going to put 2-3 mils on, game's over. I don't know what that means in terms of how much progesterone you need.
This podcast and any information, advice, opinions or statements within it do not constitute medical, healthcare or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.